I'm pleased to introduce a guest whose work brings together preventive medicine and oncology. He is a board-certified physician in internal medicine, haematology, and medical oncology, and has spent almost two decades helping people understand their health so they can prevent illness rather than wait for it. He has looked after cancer patients across the United States, including at Weill, Cornell, New York Presbyterian Hospital and the Alaska Cancer Treatment and Research Center, before leading breast and urologic oncology at St. Mary's Medical Cancer Center. He now runs preventive medicine and cancer care, a boutique practice focused on integrative care, risk assessment, and personalized support for both health-conscious individuals and cancer survivors. Dr. Mark Levandovsky, thank you for joining us today.
My pleasure. Thank you so much for having me.
Okay, so Dr. Mark Levandovsky, after, of course, like what I've said, you have worked in oncology and hematology across several major centers from New York to Alaska. So what first drew you into this field of medicine?
Great question. I think it was initially helplessness, actually. There was so much powerlessness and so much fear that comes with a diagnosis of cancer, so much feeling that, what can we do? Initially, it was this passion for helping people, empowering them. And there's a lot of misinformation. So the more desperate we are, typically, the more we try to lean on resources that really could be questionable. So really bringing the evidence-based medicine with a very compassionate care was the primary impetus. And then as I started practicing through different oncology centers and running them, I really wanted to focus much more on prevention and much more on proactive care, so that I am meeting my patients more as a preventative oncologist as opposed to a reactive traditional oncologist. There's so much we can do to early diagnose, to prevent by personalizing care and seeing who is in front of us and who's at risk. So that was the gist of, I think, the evolution of my program.
Mm-hmm. Now, hearing your career began gives a sense of medical world from the inside. So I'm interested in how those early years shape your view of a wider healthcare system.
It's been quite an evolution. And initially, during the intensive subspecialists, especially, you kind of firefighting. So you don't have much bandwidth to keep your head above water. It's just survival. And accumulating sort of the medical lore and being able to navigate through different conditions. That probably takes a decade. So I would say that physicians are sort of an evolution for the first decade of their career, until the expertise is expansive enough to be able to see different perspectives. And I think that's what happened with me as well, through the training process, both in a very private setting, in a community-based setting, in serving the underprivileged. You see the breadth of what happens. And the reactive medicine, the allopathic medicine is excellent. And that's what you see, that once something dire happens, if something's acute happening, allopath MDs are very good at nipping it, right? Giving antibiotics, cutting something out. But the preventative aspect is sorely lacking. And that became more and more apparent through the training. And the more I started practicing oncology, especially in the breast, urological, and colorectal worlds, I was dumbfounded by how my patients who were putatively cured from their early cancers would succumb to other metabolic diseases, to cardiovascular complications, to other cancers, which opened my eyes to the systemic nature of these illnesses. It's not just early breast cancer, you get your surgery and you're done. It's not just early polyp in the colon and you take it out and you're done. It's a harbinger for a much bigger systemic issue. And the more I started practicing that way and looking at global trends, what happens in other countries, the more it was just eye-opening how we can emphasize not, again, reactive medicine and chasing after allopathic diagnoses and reacting to them, but actually risk stratifying the people in front of you, really gauging what their risks of cancer, 12 most common cancers would be, as well as cardiovascular and autoimmune diseases would be, and how we can be much more preventative minded before these problems hit, before they need us as a traditional cardiologist or a traditional oncologist. So I piloted that program, actually running a cancer center in Colorado, both for patients with relatively early diagnosis of breast, colon, and prostate cancers, expanding the program both to them and their family members. And just because it was so rewarding and so impactful, I severed the umbilical cord with a traditional hospital system, which was very much focusing on reactive aspects, and started focusing on preventative treatment of conditions that kill us.
Yeah, and as you've mentioned, prevention seems to be the missing piece. It rarely gets any attention, and you've developed the idea of a health portrait. So I would like to understand how it works in practice. That health portrait. Could you explain what that means and how it differs from the usual checkup most people receive?
Yeah, happy to. So first and foremost, the amount of resources we have for personalized care and stratification is immense. If we look at the world of oncology and cardiology, we can really, really risk assess someone and know their likelihood of, say, as I said, 12 most common cancers, prostate, breast, colon, pancreas, kidney, to be come to within a 10% margin of error. And we could do something very similar with cardiovascular complications, the expectation of heart attacks and strokes. That assessment often entails two key components which are missing in traditional care. The first and foremost is time. With 8-minute visits with a primary care, it's impossible to do this assessment. It's just, no matter how good of a physician you are, you need face time with your patients. You need to establish a relationship. You need to understand how to connect with them, what makes them tick, and how to implement change on their level. So both the assessment part, which is a thorough, comprehensive medical history, genetics, exposures, lifestyles, choices, diet, exercise, nutrition, you cannot, by definition, pack that into 8 minutes. And that's probably the main Achilles heel of traditional primary care. My intake is close to 3 hours, right? We really delve into their entire medical story, gather all of the information, get their genetics. So I think that's a huge component. Now, the second component is second, but it's equally as important as expertise and being able to lean on different tools that enable us to make that assessment. So many of the tools that are now implemented for risk assessment, cardiovascular and cancer, really are outside of insurance. Just because they might be newer, just because they might be in evolution, or because the price tag is such that a traditional insurance coverage deems it not necessarily cost effective to implement for everyone. And then everyone gets kind of an average answer, like what their average risk is or what their average maladies are. I've yet to meet an average person. It doesn't exist. We're all unique. We all have our own set of idiosyncrasies and insanities, right? We all have our particulars. And that's why the average process doesn't work. Let me give you an example. If you see an average primary care doctor, I don't care concierge or not, and that person does every standard test that's recommended for an age group for cancer early detection and screening, that primary care doc will pick up 14% of what kills you neoplastically. 76% of what kills us will go completely undetected until symptoms appear, until the person in front of you is sick. And at that point, there's over 1 billion cells with very high likelihood of metastatic potential. And often the battle has been lost. So we don't have to follow that paradigm, I found. We can certainly lean on many of the early detection markers that give us inflammatory early biomarkers, tumor marker detection that has been implicated in early detection. So in my program, in addition to the face time and the time spent, I use personal vascular age. I look at person's vascular health, how old their vessels are. I look at inflammatory markers. I look at tumor biomarkers. I look at metabolic markers that are associated with cancer and cardiovascular disease. I look at early microscopic markers of blood clotting and bleeding, which are also related. So if we're seeing those markers and it's a mosaic of a portrait, we can say there is something off with you. You might look good on the facade, on the exterior, but if we look internally, your vascular age is off, your plaque burden is off, you've got precancerous tumors, you've got an inflammatory marker, you've got a metabolic and insulin marker that is putting you at 2, 3, 4, 5 time fold risk of cancer. And when we couple that with genetic analyses that we do, and we see what you've inherited from mom and dad, what's actually floating genetically, DNA-wise, in your bloodstream, that can really be a game changer. So combining genetic, molecular, exposure, personalized medical history with imaging that we do, looking at the lung architecture, looking at the abdomen and pelvis in populations at risk, looking at the genetic analysis and molecular analysis, you can come up with very, very accurate either reassurance, like, hey, you're doing great, keep doing what you're doing. Or in majority of cases, I'd say probably 75% of the cases, hey, we really need to focus on, say, these 3 top conditions, and this is your personalized plan, ABC.
And of course, when we talk about genes, as you've highlighted, Dr. Levandovsky, people often wonder how much control they really have. And as you've said, the interaction between heredity and daily habits becomes crucial. So how do lifestyle patterns interact with genetic risk? Is one more influential than the other, or do they amplify each other?
Yes, excellent question. It's really a partnership. And the partnership is such that you need to understand what's driving the risk. And thankfully, in the vast majority of cases, 85% plus, it's not the genetics that drives the train of cardiovascular complication of cancer. It's really the lifestyle and choices. Now, the 15%, when it is hereditary, it could be highly, highly, highly impactful as far as risk and as far as the screening modalities that we would use. Meaning that if someone's at higher risk because the genes are more susceptible to development of cancer, then we really ought to implement more aggressive, more thorough detection strategies with imaging, with labs, with frequency of follow-up, focusing on the areas at risk. I think what's really important to keep in mind is that 85% of what happens to us is really within our control. It's really driven by day-to-day choices, practices, and habits. And we know that the biggest set of cancers that are on the rise are early breast and colorectal cancers, and actually pancreatic cancers in younger population. By younger, I mean under 55. And that really has to do with the sedentary and highly processed lifestyle that we choose, how we deal with stress, how we deal with anxiety, how we deal with discord. So as such, we can really impact that change once we understand our habits and what's driving what, and then make a different choice. I'll give you an example because it probably speaks volumes, because we know from lots of studies, like National Health Institute studies, that the vast majority of Americans do not understand risk, and they think that if they don't chain smoke, if they don't hang out in McDonald's daily, then they're fine. And it's such a fallacy. It's such a fallacy. As an example, many of my patients drink, I don't know, 1 to 2 drinks a day. So 10 plus drinks a week, typically. And what is absolutely astounding to them is that during the conversation, I tell them that they actually smoke. And they try to battle me on it, saying, of course I don't smoke. It's anathema, I don't smoke. And the equivalent of about a drink a day is close to 3/4 of a pack per day. So the risks of that amount of alcohol consumption, in addition to some of the other sedentary life habits and dietary choices, far exceeds ultimately the consistent smoking, which they wouldn't fathom doing. So once you really are able to highlight that perspective, people are much more empowered to understand what drives it and how to change. So the diet needs to change, their body composition needs to change, the amount and the duration and the time of doing aerobic versus anaerobic workouts often needs to change. The types of nutrition is very helpful. The type of supplementation is very helpful, like when to take omegas, when to take fish oil, when to take vitamin D, when to lean on anti-inflammatories, right? What are the components of their food? All of those things are very important and very much play into their insulin balance, into their testosterone balance, into their hormonal balance, and driving their risk of common cancers and cardiovascular disease. And then what's important is that we measure and we monitor that progress. So if they're starting out with, say, an intra-abdominal fat driven by their habits, drinking, choices of a certain thickness. And we know what thickness is associated with cardiovascular and cancer diseases, right? And then we monitor it over time. When we see that thickness shrink, we know that they're less at risk. We can monitor their cardiovascular health by vascular age. How old are they today? How old are they in a year, in 2 years? We can monitor the inflammatory and cancer biomarkers and their clotting biomarkers and seeing that improves, right? We can see their liver fat content and inflammatory content. So combining all of those things, we can really undo the genetic risk. We can diminish the genetic risk that they may have, but most of them don't have, to go from above average to way, way below average and get them into really boring categories. So even though they may have a genetic predisposition, if they do everything right, lifestyle-wise, that risk could be cut by 2/3. Let me say it again. The lifestyle and habits, choices that we make day after day, can cut our risk of malignancy, of cardiovascular disease by more than 2/3. And that's probably the biggest impact that we can have on health and wellness that we would do, regardless of genetics.
And of course, just to follow up on that, once we recognize hidden risk, you mentioned about genetics, lifestyle, and diet. The larger question is how much control we truly have over a health trajectory. I mean, like, how much of our future health is shaped by inevitability, and how much can realistically be prevented with the right strategies?
It's hard to generalize as a non-specific, and I would put it in 15 versus 85% of the population. 15% of the population that carries certain genes that would put them at risk are really in a different category, meaning we really need to be on top of our game, pulling out all the little tricks, medications, lifestyle, exercise, habits that diminish that risk. So, for instance, like a BRCA gene, which is one of the most common genes that is associated with breast cancer, gastrointestinal cancers, prostate cancers, can portend a very, very high lifetime risk, upwards of 80%, say, of breast cancer for a woman. And that woman would be in a very different genetic and personal risk assessment of what to do, as opposed to an average woman that has normal genetics, doesn't have a BRCA1 gene or BRCA gene, and then we're trying to impact her choices long-term with lifestyle and habits, medications, monitoring, detection, right? So first thing first, we need to understand who's in front of us. If a woman in front of us has an 80% risk of breast cancer based on her genetics, we should focus on health and wellness, but it would be silly to disregard the underlying genetic makeup and say, well, we can just go to Tibet and meditate for a decade and be fine. We need to be risk conscious and say, well, based on your risk, we need to do potentially surgery, potentially medications, potentially this imaging strategy, which is much more aggressive because of your genetics. So it's not inevitable that the outcome will happen, but burying your head in the sand strategy is much more likely to be deadly. Now, if a woman does not have the genetic predisposition, then the control aspect and the inevitability aspect is much more on her side. On his side, if it's prostate cancer or the cancers that are much more lifestyle and habits preventable. So I would say that for the 85% who do not have an obvious, strong family history of cancers, or do not have genes that are maybe overriding their risk, the likelihood that they can reduce their risk for the 85% who are more genetically normal, right? They can reduce their risk by 2/3 plus. And it's by no means inevitable. It is much more likely that they can have a huge impact on their health and wellness than by ignoring the issues and keep doing sort of the inevitable. The 15% or so who are genetically predisposed would have a much, much, much worse outcome if they're not in a program like mine and they're not proactively monitoring and trying to reduce their risk. And that could be either through preventative surgical approaches, through more aggressive monitoring, through medicines and supplements, because their risk of cancer could be 10-fold higher than average. So then if we leave it to our own devices, genetic devices, then the outcome much more often is inevitably poor. If we know what we're dealing with and we know what we need to screen for, then all the studies are showing that for that population, we're saving lives threefold higher, fourfold higher than not doing it. So mortality for high-risk patients would be over, say, 25% lifetime. We can reduce it fourfold.
But of course, Dr. Lewandowski, control also depends on timing. I mean, like prevention at the right moment may look very different from prevention that begins too late. So, at what age do you think prevention needs to begin in a deliberate and strategic way? And what happens if people wait too long?
Yes, it's a question of when is someone ready versus when is someone willing and what resources they have. Obviously, when we're talking about prevention, the younger the better. I don't mean teens, but usually late 20s, 30s, early 40s. That's really important to implement and ground healthy habits. Obviously, it happens growing up with parents and lifestyles that are deemed psycho-emotionally helpful. We'll pick habits that somehow sit well with us. And we often just learn them from family or absorb them passively. The more mature we become and the more ready we're to understand, well, why am I doing this thing? Is it actually a good thing for me or not? Which, in my experience, usually happens when someone is in their third decade, usually in the 30s. Late 20s to 30s is when we start pausing and thinking, what's going on? And then in the 40s, when we start understanding that we're not invincible, then more changes happen and maybe more resources are. So usually the younger, the better. And it's not too late when it's in the 50s and 60s. Just the impact is probably going to be less. Also, depending on how hard of a lifestyle and how much hard living one's done growing up. So I'd say it's never really too late. The younger, the better, especially in the 30s. And the consistency of it is much more important ultimately than the vast oscillations. If someone goes vegan for a year, right? And it's not ultimately as impactful as a consistent, healthy, balanced lifestyle and diet for years and years to come, right? You don't want to make, by and large, huge drastic changes which are hard to sustain. Incremental, consistent, congruent changes that you can grow into and you can build on day after day, months after month, are much more impactful. So if someone's implementing those changes in their 20s, 30s, 40s, it's going to give them amazing dividend in their 60s, 70s, 80s. If someone's not able to do it until their 50s, 60s, but they're still implementing it, they will have reduced their risk significantly by a third to 40% maybe. And we would focus also on the early detection. So the program that I'm implementing, for instance, is screening and early detection, because again, we don't want to be cavalier and stupid and saying, well, we can just disregard the choices that have been made for the last 6 decades and we're just going to meditate all conditions away. That's really foolish. You need to say we're going to do both.
Mm-hmm. And of course, some people often seek simple routines to stay healthy, and many follow the same kind of template of food, exercise, sleep, and supplements. We try to exercise often, we sleep well, we take vitamins enough. So I wonder where that approach succeeds and where it falls short.
There is so much information and misinformation about what's a healthy lifestyle, what's a healthy amount of exercise, what's a healthy nutrition. It's incredibly confusing to say the least, and sometimes misleading. And the consistency part of it is also tough, because if you don't truly ultimately know, and you could be persuaded one way or the other, then it's very hard to pick a path that you stick with and that works for you, right? Because we become reactive. And that's why if you look at the amount of different diets there, how do you pick one? Like, now this isn't fad, right? Or that's much more popular, so let me go from one to the other. And we become very myopic in picking out a strategy. It's almost like, I don't know, a political scene, right? We're so focused on a short goal, short-term success. We see it in our everyday life, right? Finances, short-term, often, right? Quarterly reports, midterm elections, like everything is just working for few-year time span. We're not looking at 10, 20, 30, 50 years. And it's foolish. It's foolish, and it's congruent with how we're being, I think, seduced by so many pressures in the world, right? We are tickled to have a dopamine hit from whatever it is, from a diet, from an exercise, from politics, from religion, from whatever. And ultimately the driver of health and wellness is a long-term, consistent, secure, and mature strategy. And that entails a rapport, a relationship, and understanding that you can maybe get rid of some of the fluff and really focus on the key drivers, which we know a lot about. As physicians, if we look at this and we do our due diligence, there is really a lot of information that is consistent between different populations, between different studies, between different risks. And rather than jumping and hopping to something that's hot, let's just look at the as total a body of research as we can that's been consistently to show to be pro longevity. That's consistently been shown to reduce the risks of cardiovascular and cancer maladies throughout different continents, and see what those formulas are, and then implement them. And if something needs to be modified and tweaked on an individual level, fine, let's do that. But we know what the components are. Like, we know what the basic components of diet and exercise are. We know that you cannot offset your poor nutrition with rigorous exercise. We know that weightlifting and focusing on a muscle mass long term does not contribute to longevity. We know that declaring a war on carbs does not produce proclivity towards long-term health results. Right? We know that focusing on immediate weight loss is gonna bite us. Right? It's not a sustainable issue. We know that saying and avoid all bad habits doesn't work, because you're gonna go sideways and pick something else. Right? It's much more of a focus on what should I do? What am I going towards? Is a way, what am I getting away from? We as humans are programmed to be away from often, right? We're trying to avoid problems. We're trying to avoid anxieties. And the goal ultimately is to implement enough of it towards. What am I moving towards? How am I moving towards health and wellness? How am I addressing my stability, my mental health? How am I addressing my good long-term relationships? How am I building my physique? What is behind it, right? It's really those types of conversations that lead long-term happiness. Connection, movement, nutrition as broad categories, looking at decades plus of investment. That's the emphasis. And that's what I emphasize in my practice.
Thank you. Lovely talking to you, Dr. Levandovsky. But before we wrap up, I would like to finish with a few lighter questions just to get to know you a little better. So the first quick fire question is, what were you afraid of as a child?
I was afraid of the dark. And I was very much afraid of, I think, not knowing what to do with sick parents. I unfortunately had firsthand experience of uh, family members battling cancer, battling cardiovascular and mental health, and feeling very much powerless to address it.
Mhm.
Um,
And
so, uh, so that I think that shaped the drive to know and deliver and be able to give something of substance.
absolutely. And what is your favorite word in another language?
Hmm. I think it's tranquility and
Tranquility.
balance.
In another language other than English. I know you're fluent
Tranquilo,
in Russian.
tranquilo.
Tranquilo. Okay.
Yeah, I think it would be Spanish.
Okay. And if you hadn't been doing what you're doing, what would you have pursued in your life?
Interesting. I'm not sure that I am well wired for other industries. I think my skill set is really sort of medicine. So maybe I would be doing um, like healthcare and novel
Mhm,
strategies um, as far as treatment and implementation. But I'm really wired, I think, to do this. It's a gift.
mhm. And finally, the floor is all yours. What should people take away from today's conversation?
Hopefully empowerment, I would say. There is so much that's not written that is within our control, and we really have such a profound fundamental impact on our psycho-emotional and health destinies that um, I really extend my community at large to pursue that strategy of health and wellness, partner with physicians and practitioners and communities that are like-minded and long-term health and wellness focused. Wishing you all the best.
That's a fantastic note to end on. Your perspective on prevention, risk, and personalized health has been thoughtful and clarifying. Dr. Mark Levandovsky, it's been a real pleasure having you here on the DRH show. Your work reminds us that health begins long before illness appears. Thank you.
My pleasure. All the best.